everyone. I'm Dr. Raghu Nagaraj. I'm the Senior Orthopedic Consultant Surgeon at Fortis Hospital, Cunningham Road. I specialized in knee and shoulder injuries. I'm here to talk about the PCL injuries. PCL is one of the strongest ligament of the knee joint. I'll show you in the model. So this is the knee joint. That's the thigh bone on the top and the leg bone below. Between these two bones, we have two important ligaments. One in the front part of the knee, that is called ACL ligament, that is anterior cruciate ligament, and one on the back side, that is PCL, posterior cruciate ligament. PCL is the largest ligament in compared to the size compared to the ACL ligament. Normally in our day-to-day practice, we come across a lot of ACL injuries. PCL injuries are not so common, but still it accounts to around 20% of the overall knee injuries. So what is the function of this PCL ligament and how does this ligament gets damaged? I'll tell you about it. PCL provides the stability to the knee joint in the backward movements, and it usually gets injured when there is a road traffic accidents, especially the dashboard injuries or direct blow to the front part of the knee joint. This usually happens in dashboard injuries. So when the patient is sitting in a car, when suddenly the brake is applied, or when they met with an accident, the leg bone hits the dashboard, causing that excessive severe movement towards the backward, causing the injury to the PCL ligament. That's why we call it as a dashboard injuries. So normally the symptoms that patient faces after the ACL tear or ACL injury is pain and swelling, which usually subsides with time. But most of the patients tend to ignore this PCL tear because PCL doesn't give instability episode unlike anterior cruciate ligament. So that's why the presentation of the PCL tear is usually a bit delayed to the doctors. So patient usually starts feeling pain, especially when they do climbing activities like climbing up and down the stairs or trekking activities. When the bone moves front and back, the bone starts rubbing against each other. That's what gives the pain and swelling on and off, but again which usually subsides once they take rest. So that's the reason why most of the patients ignore these PCL injuries. So how do we diagnose these PCL injuries? Usually clinical examination. When we do a thorough clinical examination of the knee joint, we can easily assess the competency of the ACL and PCL and also the associated ligaments as well. So once we get an idea what is the extent of the injury, then we'll do an MRI scan of the knee joint. MRI scan will help us to assess the severity of the ligament tear, whether it's a partial tear or just a sprain or a complete tear. And also we can assess the associated structures of the knee joint like meniscus, cartilage and other ligament damages in the knee joint. So once the assessment is done, we'll decide the treatment according to the severity of the injury. If the damage is mild like in sprain or a partial tear, usually physiotherapy and other conservative treatment is enough. Patient will be made to undergo strengthening exercise program and then subsequently the reflexes and other muscle balancing exercises, so which will definitely enable him to get back to the normal activities, whether it's sports or other normal day-to-day activities. If the damage is a little bit more like grade 3 or a complete tear of the PCL ligament and the patient is having a lot of pain and associated structural damages like meniscus and the cartilage, then we advise them to go for a surgical treatment. Surgery is very simple. It's done by a orthoscopic technique. It's a minimally invasive keyhole surgery where we make a small keyhole, pass the camera, looking in the camera we can reconstruct the PCL back. Some scenarios the ligament itself will be normal, but it will be detached from the leg bone with a small piece of bone, what we call as a PCL avulsion fracture. If the patient presents to OPD very early, within 3 weeks from the injury, then we prefer to fix the bone back again with orthoscopic technique and help in retaining back the normal ligament. If the patient presents to us more than 3 or 6 weeks old, then the treatment is the same. There is orthoscopic PCL reconstruction, just like in PCL ligament tear itself. As I told you, the surgery is very minimally invasive. With the keyhole technique, we can fix the fracture, also reconstruct the ligament depending on the type of the injury. The graft option available for the PCL tear is two. One is a hamstrings tendon. So 2 to 3 inches below the knee, we'll make a small another keyhole and take one tissue called hamstrings. It's a normally available tendon and it's equally competent and strong like the virginal ligament. We'll take the tendon, prepare it as a ligament and pass it from the one bone into another bone where the original ligament was supposed to be attached, and then fix it with 2 small screws on both the sides. Another graft that's available is a quadriceps tendon from the upper part of the thigh. So this is also equally strong. So any one of the tendon we can opt for and reconstruct the PCL. As I told you, if the ligament is normal, if it's detached from the piece of bone, then using the same keyhole technique, we will tie that bone piece with a strong wire and pull that wire to the front part and fix it with a small clip called endobeton. So once we do this, the bone piece will come back to its position and get healed to the parent bone, tautening the ligament and getting back the stability. If the injury is old, like more than 6 weeks old, then we treat them like a ligament tear itself and do the reconstruction technique. After the surgery, next day the patient will be made to walk around with a walker. If we fix the bone, then the patient will be on non-weight bearing for 3 weeks and then graduated partial weight bearing for another 3 weeks. If we do reconstruction, that is putting a new ligament in the place of the old one, then they will be made to bear weight on the leg very next day with a small crutches or a walker support depending on their age and their strength in their arms. Knee range of motion will be allowed very next day in cases of reconstruction, but in cases of fracture fixation, they will be made to immobilize the knee with a brace for a period of 3 weeks, and then they will be made to bend the knee, so which will take another 3 to 6 weeks to regain back their movements. So strengthening program will be started after 6 to 8 weeks depending on their regaining of the movements. Once 3 to 4 months period from the post surgery, if the muscle strength is regained back, then they will be made to run, jog and get back to their other activities. Sports and aggressive physical activities will be allowed after 8 to 9 months from the day of surgery. So with this technique, patient can regain back their confidence on the knee and prevent further injuries to the knee joint and protect their important structures like meniscus and cartilage, which are the shock absorbers of the knee joint, and prevent the development of arthritis. So ligament surgeries are very important to help the patient to get back to all their normal activities and resume back their pre-injury sports level also. Nice stable, okay? It's not moving either anterior or posterior, it's quite stable.
I'm Muralidhar here. I've had a surgery here at Fortis Hospital yesterday, which went very successful. I'm thankful to Dr. Raghu Nagaraj for treating me. He's a wonderful doctor and you're in safe hands when you get treated with him. And as concerned Fortis Hospital, they offer good treatment and you're taken care of in a nice manner. I would definitely refer Dr. Raghu Nagaraj to many people based on my experience with him. Thank you.